Have you ever had trouble finding a new doctor after getting notified that your own physician is going to retire at the end of the month or moving to another location? I have personally lost a trusted physician to retirement, and I anticipate my current physician will retire within 3 to 5 years. What am I going to do? How is the medical community going to meet my need? How will it meet your need? Because you know at some point you will need a doctor. Did you know that the state of Arkansas has a physician shortage, especially in rural areas, that's driven by the increased number of Arkansans having access to care through the Arkansas Works, the Medicaid expansion program? Our aging population needs more care, and a third of all active physicians will be age 65 or older within the next 10 years, and they will retire. We need more physicians in the state of Arkansas, and one way to get them here is to educate or grow our own doctors. With a medical program such as the Arkansas College of Osteopathic Medicine, also known as ARCOM. Before I tell you about ARCOM, let's explore the differences between MDs and DOs. MDs learn allopathy in medical school. It's the more traditional of the two philosophies, and it's what many people consider modern medicine and science-based. Allopathic medicine emphasizes using medications to treat illnesses that are usually diagnosed by tests or procedures, such as a complete blood count or an x-ray. DOs learn osteopathy while earning their degree. Compared to allopathy, it focuses more on treating the body as a whole instead of treating specific conditions. Students learn how to evaluate people with the same tools and procedures that students of allopathic medicine do. However, they also learn how to use osteopathic manual medicine, or OMM, also known as sometimes called osteopathic manipulative treatment, OMT. This involves using the hands to diagnose, treat, or prevent injuries or illness. Examples of OMM during a physical exam include stretching out a limb, such as unfolding an arm, applying gentle pressure or resistance to specific areas. Right here is where a lot of people get tension. Feeling someone's bones or joints, organs, or other structures through their skin. It's important to note that all DOs learn these techniques, but not every DO uses them in their medical practice. MDs and DOs have much of the same training, including 4 years of medical school after earning a bachelor's degree, a residency program lasting 1 to 7 years after completing medical school. The main difference is that DOs must complete an additional 200 hours of coursework that focuses on bones, muscles, and nerves, and how they affect the body's overall health. Also, DOs may take additional classes covering holistic or alternative therapies and preventive medicine, though this is still covered in allopathic medical schools. As you can see, there's not that much difference between MDs and a DO. And with the state of Arkansas now having approximately one doctor per 7,000 people, and in the year 2025, the number projected to be one doctor per 20,000 people, we simply need more physicians. Now I'll tell you a little bit about ARCOM. We opened our doors in June of 2016. There's an average of 150 students per class. Our fourth-year students, the class of 2021, will graduate this spring and are already applying for residencies. Our third-year students, class of 2022, are participating in clerkships. Our second and first-year classes, the class of 2023 and 2024, are taking classes, and interviews for the class of 2025 are already underway. Now more than ever, medical students find themselves faced with extraordinary demands, and they need our help and assistance. Ways that people in our community can support our ARCOM medical students and help fund the future include serving as a standardized patient, where people act as a patient, learn a minimal script, let the students take a medical history and perform basic skills such as taking blood pressure or listening to breath and heart sounds. Mentoring a medical student by taking them to dinner, show them the sights and sounds of our great community, and encourage them to stay in Arkansas and establish a practice. Give a $500 contribution towards the Student Scholarship Stethoscope Program that gives each incoming ARCOM student doctor an engraved stethoscope, their first tool of medicine. Scholarships are awarded on academic merit, in student performance, and need. This helps to ensure every student doctor has access to education regardless of their financial situation. Gifts can also be made in honor and memory of someone, and the student doctor recipient will receive notice of this legacy gift. Supporting the education of DOs in our hometown of Fort Smith, Arkansas. By participating or contributing will increase the likelihood of physicians staying in our area to practice, raise their families, and contribute back to our community. How wonderful would it be to someday have one of these medical students as your very own doctor?